Free CNA practice test with answers.
Question 1. If assisting a patient to brush the teeth, the head of the patient's bed should be elevated to what position? Option A, 75 to 90 degrees. Option B, 45 to 60 degrees. Option C, 30 to 45 degrees. Option D, 20 to 30 degrees.
The correct answer is option A, 75 to 90 degrees. 75 to 90 degrees.
Question 2. If planning to use a mechanical lift to move a patient who weighs more than 500 pounds, what is the first thing the nurse aide should do? Option A, get assistance from another staff member. Option B, ensure that the equipment is in good repair. Option C, explain the procedure to the patient. Option D, check the weight limit for the equipment.
The correct answer is option D, check the weight limit for the equipment. Check the weight limit for the equipment.
Question 3. If the nurse aide notes that a coworker has spilled water in the hallway when delivering it to a patient, what should a nurse aide do? Option A, wait until the coworker comes back out and tell the person. Option B, wipe up the spilled water. Option C, call housekeeping to wipe up the water. Option D, tell the nurse that there is spilled water in the hallway.
The correct answer is option B, wipe up the spilled water. Wipe up the spilled water.
Question 4. If the nurse aide observes another staff member going through a patient's personal belongings and pocketing an item when the patient is out of the room, what should the nurse aide do? Option A, assume it is at the patient's request. Option B, confront the staff member. Option C, ignore the situation. Option D, report the observation to a supervisor.
The correct answer is option D, report the observation to a supervisor. Report the observation to a supervisor.
Question 5. If the patient's care plan states turn patient Q2H, what does this mean? Option A, turn the patient 2 times per shift. Option B, turn the patient every 2 hours. Option C, turn the patient with 2 people. Option D, turn the patient with the bed in the high position.
The correct answer is option B, turn the patient every 2 hours. Turn the patient every 2 hours.
Question 6. If the patient's door is closed when the nurse aide arrives to give morning care, what should the aide do? Option A, enter quietly so as not to disturb the patient. Option B, knock before entering the room. Option C, assume that the patient does not want to be disturbed. Option D, return at a later time.
The correct answer is option B, knock before entering the room. Knock before entering the room.
Question 7. If the patient's skin sticks to the sheet when the patient slides down in bed, this is referred to as which of the following? Option A, friction. Option B, shearing. Option C, tearing. Option D, deranging.
The correct answer is option B, shearing. Shearing.
Question 8. If, when assisting a patient to undress, the nurse aide notes bruising and behavior that suggest a patient may be a victim of abuse, what should the nurse aide do? Option A, ask the patient about it. Option B, stay quiet because there is no proof. Option C, report the concerns to the nurse. Option D, provide the patient with the number of an abuse hotline.
The correct answer is option C, report the concerns to the nurse. Report the concerns to the nurse.
Question 9. In Maslow's hierarchy of needs, the level that addresses the social, creative, emotional, and spiritual potential within a person is: Option A, self-actualization. Option B, esteem. Option C, love and belonging. Option D, physiological.
The correct answer is option A, self-actualization. Self-actualization.
Question 10. In a care conference, who is most responsible for the patient's care plan? Option A, the patient. Option B, the nurse. Option C, the doctor. Option D, the CNA.
The correct answer is option B, the nurse. The nurse.
Question 11. In a home care setting, CNAs typically work: Option A, only under a nurse's supervision. Option B, only with elderly patients. Option C, without any supervision. Option D, exclusively with terminally ill patients.
The correct answer is option A, only under a nurse's supervision. Only under a nurse's supervision.
Question 12. In healthcare, measurements most often documented in the metric system include: Option A, fluid intake. Option B, food intake. Option C, blood pressure. Option D, both A and C.
The correct answer is option D, both A and C. Both A and C.
Question 13. In relation to the recent outbreaks of COVID that have affected long-term care facilities, the CNA is aware that what problem has acutely risen with the residents? Option A, feelings of isolation from family and friends. Option B, feelings of worry related to death by COVID. Option C, feeling scared because the staff is in isolation attire. Option D, feelings of anger about not understanding COVID precautions.
The correct answer is option A, feelings of isolation from family and friends. Feelings of isolation from family and friends.
Question 14. In the state of California, a nurse aid training course must include option A, 100 hours of theory and 60 hours of clinical. Option B, 60 hours of theory and 100 hours of clinical. Option C, 75 hours of theory and 100 hours of clinical. Option D, 60 hours of theory and 60 hours of clinical.
The correct answer is option B, 60 hours of theory and 100 hours of clinical. 60 hours of theory and 100 hours of clinical.
Question 15. Increased swelling in the legs, frequent urination at night, and shortness of breath are common symptoms of option A, peripheral vascular disease, option B, chronic pulmonary obstructive disease, option C, congestive heart failure, option D, diabetes mellitus.
The correct answer is option C, congestive heart failure. Congestive heart failure.
Question 16. Information indicated on the urine and stool sample container includes the residence. Option A, name, date of birth, identification number, and time collected. Option B, name, date of birth, and the date and time of the specimen collected. Option C, room number, maiden name, and social security number. Option D, name, room number, identification number, and admission date.
The correct answer is option B, name, date of birth, and the date and time of the specimen collected. Name, date of birth, and the date and time of the specimen collected.
Question 17. Insoluble fiber aids in digestion by option A, binding to fat and pushing the fat through the digestive tract. Option B, promoting regular bowel movements. Option C, lowering cholesterol. Option D, regulating blood sugar levels.
The correct answer is option B, promoting regular bowel movements. Promoting regular bowel movements.
Question 18. It is estimated that delirium is noted in at least 40% of nursing home residents in the United States. The CNA is aware the resident with delirium might suffer from what symptom? Option A, resident becomes tearful and upset at small changes in schedule. Option B, resident see or hears things that other residents and staff do not. Option C, resident becomes weaker and experiences episodes of incontinence. Option D, resident loses the ability to speak.
The correct answer is option B, resident see or hears things that other residents and staff do not. Resident see or hears things that other residents and staff do not.
Question 19. It is outside the scope of practice for a nursing assistant to option A, help a resident eat dinner. Option B, insert tubes into a resident's body. Option C, offer emotional support to the resident's family. Option D, provide dementia care.
The correct answer is option B, insert tubes into a resident's body. Insert tubes into a resident's body.
Question 20. Janice is an older resident who has been asking to go to the bathroom nearly every hour. She has also had some incontinent episodes, which is unusual for her. She has no complaints of pain, but you notice that her urine is cloudy and smells. You suspect that Janice may have option A, a kidney stone. Option B, a urinary tract infection. Option C, diverticulitis. Option D, atherosclerosis.
The correct answer is option B, a urinary tract infection. A urinary tract infection.
Question 21. John is a 50-year-old resident who is working on ambulation and fine motor control in his hands following a motorcycle accident. Those involved in his therapy might include option A, an occupational therapist. Option B, his wife and children. Option C, the physical therapist. Option D, both A and C.
The correct answer is option D, both A and C. Both A and C.
Question 22. Jonathan is a resident who has dementia. He wanders throughout the facility and often strikes out at the nursing assistant caring for him. An appropriate area for him to live would be A.N. Option A, locked unit. Option B, subacute unit. Option C, integrated unit. Option D, step-down unit.
The correct answer is option A, locked unit. Locked unit.
Question 23. Joseph is a resident who just had knee replacement surgery a few hours ago and is on strict bed rest. The best method to prevent Joseph from developing blood clots is option A, sequential stockings. Option B, antiembolism stockings. Option C, active range of motion exercises. Option D, ambulating short distances.
The correct answer is option A, sequential stockings. Sequential stockings.
Question 24. Leanna is a resident who is on oxygen at 4 liters per minute. When you enter her room, you notice that the humidification bottle is not bubbling. This means that Option A, the oxygen is not flowing properly. Option B, Leanna has taken the nasal cannula out of her nose. Option C, the oxygen is flowing at the correct rate. Option D, the oxygen rate needs to be turned down.
The correct answer is option A. The oxygen is not flowing properly. The oxygen is not flowing properly.
Question 25. Linens in long-term care facilities are typically changed. Option A, every day. Option B, once or twice a week. Option C, every 2 weeks. Option D, only as needed.
The correct answer is option B, once or twice a week. Once or twice a week.
Question 26. Linens should be fan-folded to one side of the bed when the resident is. Option A, being transferred from a stretcher to the bed. Option B, ready to go to bed for the night. Option C, first admitted to the hospital. Option D, at risk of developing pressure injuries.
The correct answer is option A, being transferred from a stretcher to the bed. Being transferred from a stretcher to the bed.
Question 27. Mark is a 40-year-old resident who suffers from post-traumatic stress disorder. He experiences nightmares, doesn't engage in conversation with his caregivers, and rarely makes eye contact. This is an example of an Option A, neurological disorder. Option B, emotional deficit. Option C, expressive aphasia. Option D, speech impairment.
The correct answer is option B, emotional deficit. Emotional deficit.
Question 28. Maurice is one of your residents whom you are taking care of today. When you enter his room, you notice that he is shaking and appears anxious. His skin is sweaty and cool when you touch him. He seems confused when you ask if he is feeling all right. Maurice may be experiencing Option A, hyperglycemia. Option B, hallucinations. Option C, hypoglycemia. Option D, peripheral vascular disease.
The correct answer is option C, hypoglycemia. Hypoglycemia.
Question 29. Medicare is a healthcare program primarily for Option A, homeless children. Option B, programs that provide food to the elderly. Option C, low-income individuals. Option D, government-funded healthcare for certain groups.
The correct answer is option D, government-funded healthcare for certain groups. Government-funded healthcare for certain groups.
Question 30. Michael is a hospital patient recovering from a car accident. He has N4 in his right hand. You need to dress Michael in a clean hospital gown. You should. Option A, feed the 4-bag and tubing through the right sleeve, followed by his right arm. Option B, feed the 4-bag and tubing through the left sleeve, followed by his left arm. Option C, put his right arm through the right sleeve, followed by the 4-bag and tubing. Option D, have the nurse disconnect the 4 tubing while you dress Michael.
The correct answer is option A, feed the 4-bag and tubing through the right sleeve, followed by his right arm. Feed the 4-bag and tubing through the right sleeve, followed by his right arm.
Question 31. Most of the care provided at an assisted living facility, ALF, is delivered by Option A, physicians. Option B, personal care assistants. Option C, registered nurses. Option D, physical therapists.
The correct answer is option B, personal care assistants. Personal care assistants.
Question 32. Most staph infections occur, Option A, on the skin. Option B, in the eyes. Option C, in the nose and respiratory tract. Option D, in the digestive tract.
The correct answer is option A, on the skin. On the skin.
Question 33. Modeling is most likely to appear on the residents. Option A, chest. Option B, abdomen. Option C, legs and feet. Option D, face.
The correct answer is option C, legs and feet. Legs and feet.
Question 34. Mouthwash should be offered to the alert and oriented resident. Option A, before providing oral care. Option B, after providing oral care. Option C, as a replacement for brushing. Option D, either A or B.
The correct answer is option D, either A or B. Either A or B.
Question 35. Mr. Krieger has been able to take care of himself at home, but he has been forgetting to take his medications and occasionally wanders away and becomes lost. Because he lives alone, his family is concerned for him and wants to ensure that he is safe. The best option for Mr. Krieger would be to Option A, hire a nursing assistant from a hospice agency. Option B, move into a community-based residential facility. Option C, have a home healthcare agency set up his medications for him. Receive daily skilled nursing care. Option D, move into a community-based residential facility.
The correct answer is option B, move into a community-based residential facility. Move into a community-based residential facility.
Question 36. Mr. Peterson often leaves the dining table after only eating a few bites of food. One of your coworkers decides to put his wheelchair between the wall and table so he stays and eats. This is an example of option A, abandonment, option B, physical abuse, option C, defamation, option D, false imprisonment.
The correct answer is option D, false imprisonment. False imprisonment.
Question 37. Mrs. Milton is found to be stable following her hip surgery and no longer needs daily nursing care. Mr. Milton can care for her at home, but she needs physical therapy to strengthen her hip and leg. The best option for her is to option A, be admitted to a nursing home, option B, find an assisted living facility that offers therapy, option C, return home and go to outpatient therapy, option D, go to a subacute hospital.
The correct answer is option C, return home and go to outpatient therapy. Return home and go to outpatient therapy.
Question 38. Negligence occurs when a caregiver, option A, does not follow the standards of her job, option B, does not provide care and the resident then suffers harm, option C, physically touches the resident without permission, option D, limits the resident's ability to move throughout the facility.
The correct answer is option A, does not follow the standards of her job. Does not follow the standards of her job.
Question 39. Nervous system changes that take place during the dying process include all of the following except option A, twitching movements, option B, decreased alertness, option C, hallucinations, option D, loss of hearing.
The correct answer is option D, loss of hearing. Loss of hearing.
Question 40. Nonspecific defense mechanisms that keep a person healthy include all of the following except option A, antibodies, option B, intact skin, option C, mucus in the nose, option D, cilia in the lungs.
The correct answer is option A, antibodies. Antibodies.
Question 41. Normal signs of aging include option A, slowed response time, option B, temperature regulation changes, option C, vision changes, option D, all of the above.
The correct answer is option D, all of the above. All of the above.
Question 42. Nursing assistants who work in a subacute care facility provide care for residents. Option A, immediately after surgery. Option B, who are medically stable but require 24/7 nursing care. Option C, who cannot afford a hospital stay. Option D, during business hours only.
The correct answer is option B, who are medically stable but require 24/7 nursing care. Who are medically stable but require 24/7 nursing care.
Question 43. OSHA regulations help protect the option A, healthcare facility, option B, long-term care resident, option C, resident's individual health information, option D, healthcare worker.
The correct answer is option D, healthcare worker. Healthcare worker.
Question 44. OSHA regulations help protect the option A, resident's individual health information, option B, healthcare worker, option C, long-term care resident, option D, healthcare facility.
The correct answer is option B, healthcare worker. Healthcare worker.
Question 45. Of the following persons, the one most vulnerable and at risk of abuse would be A. Option A, 17-year-old high school boy, option B, 9-month-old baby girl, option C, 23-year-old college student, option D, 40-year-old married woman.
The correct answer is option B, 9-month-old baby girl. 9-month-old baby girl.
Question 46. Older adults are at a higher risk of infection because option A, they don't wash their hands as often, option B, people's immune systems grow weaker as they age, option C, blood circulation increases as a person ages, option D, they watch more television.
The correct answer is option B, people's immune systems grow weaker as they age. People's immune systems grow weaker as they age.
Question 47. Older residents may be at risk of abuse because they option A, often don't recognize abuse when it happens, option B, strike out at others, option C, may fear losing their caregiver, option D, have little control over their actions.
The correct answer is option C, may fear losing their caregiver. May fear losing their caregiver.
Question 48. One example of assault might be option A, telling a resident he may lie down only after he eats lunch, option B, not answering a resident's call light, option C, leaving an immobile resident in a locked chair, option D, leaving the facility before your replacement arrives.
The correct answer is option A, telling a resident he may lie down only after he eats lunch. Telling a resident he may lie down only after he eats lunch.
Question 49. One example of sensory stimulation therapy might be option A, giving the resident a hand massage, option B, talking about the resident's family, Option C, helping the resident play bingo. Option D, assisting the resident during a fishing trip.
The correct answer is option A, giving the resident a hand massage. Giving the resident a hand massage.
Question 50. One factor that can influence the grieving process is the cause of death. What impact can this have on the grieving process? Option A, the cause of death has no bearing on the grieving process. Option B, the cause of death brings up bad memories. Option C, death often reminds us of our past losses and how that individual passed. Option D, none of the above.
The correct answer is option C. Death often reminds us of our past losses and how that individual passed. Death often reminds us of our past losses and how that individual passed.
Question 51. One of the main functions of our skin is to: Option A, carry nutrients. Option B, clump melanocytes. Option C, protect against infection. Option D, transport oxygen.
The correct answer is option C, protect against infection. Protect against infection.
Question 52. One of your coworkers assists Mrs. Baker into a recliner and puts her feet up so she doesn't get out of the chair without assistance. Mrs. Baker is unable to use her call light because of dementia. This is an example of: Option A, abandonment. Option B, physical abuse. Option C, defamation. Option D, false imprisonment.
The correct answer is option D, false imprisonment. False imprisonment.
Question 53. One of your residents' weight this morning is 83 pounds. The nurse asks you how many kilograms the resident weighs. The correct reply is: Option A, 37.7 kilograms. Option B, 182.6 kilograms. Option C, 166 kilograms. Option D, 41.5 kilograms.
The correct answer is option A, 37.7 kilograms. 37.7 kilograms.
Question 54. One of your residents appears nervous and states that he has an appointment for a biopsy. This means that he has an appointment for: Option A, the removal of a small number of cells. Option B, a type of cancer treatment. Option C, the loss of hair. Option D, a type of radiation.
The correct answer is option A, the removal of a small number of cells. The removal of a small number of cells.
Question 55. One of your residents has lung cancer and must use oxygen. There isn't enough space in the dining room for all the residents and his oxygen machine. 2. The best option is to: Option A, ask the resident to eat his meals in his room. Option B, offer 2 mealtimes to accommodate all the residents. Option C, have the resident eat in the dining room before the other residents. Option D, place the oxygen machine in the hallway.
The correct answer is option B, offer 2 mealtimes to accommodate all the residents. Offer 2 mealtimes to accommodate all the residents.
Question 56. One of your residents is not doing well. He received a very upsetting diagnosis from his doctor this morning. His daughter comes in to visit and asks you why her father seems so sad today. The best response is to: Option A, tell the daughter what happened since she is family. Option B, not answer in order to protect the resident's privacy. Option C, inform the daughter to call the resident's doctor about his diagnosis. Option D, suggest that the daughter discuss it with the resident.
The correct answer is option D, suggest that the daughter discuss it with the resident. Suggest that the daughter discuss it with the resident.
Question 57. One of your residents is unable to press her call light button because of pain in her hands. You should: Option A, offer her pain medication. Option B, tell her to remain at the nurse's desk. Option C, locate a press pad light to place in her room. Option D, ask her to come to the nurse's desk if she needs assistance.
The correct answer is option C, locate a press pad light to place in her room. Locate a press pad light to place in her room.
Question 58. One of your residents received a very upsetting diagnosis from his doctor this morning. His daughter comes in to visit and asks you why her father seems sad today. The best response is to: Option A, not answer in order to protect the resident's privacy. Option B, tell the daughter what happened since she is family. Option C, inform the daughter to call the resident's doctor about his diagnosis. Option D, suggest that the daughter discuss it with the resident.
The correct answer is option D, suggest that the daughter discuss it with the resident. Suggest that the daughter discuss it with the resident.
Question 59. Personal computers that translate a typed phrase into speech would best help a resident with: Option A, receptive aphasia. Option B, autism. Option C, hearing loss. Option D, expressive aphasia.
The correct answer is option D, expressive aphasia. Expressive aphasia.
Question 60. Platelets are fragments of cells that help the body to: Option A, fight infection. Option B, clot after an injury. Option C, maintain temperature. Option D, maintain fluid balance.
The correct answer is option B, clot after an injury. Clot after an injury.
Question 61. Post-mortem care is done to: Option A, prevent rigor mortis. Option B, prevent the skin from changing color. Option C, maintain a good appearance of the body. Option D, clean the body.
The correct answer is option C, maintain a good appearance of the body. Maintain a good appearance of the body.
Question 62. Professionalism in healthcare includes: Option A, providing care with compassion. Option B, a strong work ethic. Option C, arriving to work before the start of your shift. Option D, all of the above.
The correct answer is option D, all of the above. All of the above.
Question 63. Properly sized crutches should have a space between the resident's underarms and the crutch that measure: Option A, 0 inches. Option B, 1 inch. Option C, 2 inches. Option D, 3 inches.
The correct answer is option C, 2 inches. 2 inches.
Question 64. Providing fingernail and hand care for a resident helps to: Option A, prevent nails from cracking. Option B, maintain self-esteem. Option C, prevent the resident from scratching herself. Option D, do all of the above.
The correct answer is option D, do all of the above. Do all of the above.
Question 65. Receptive aphasia is the inability to: Option A, understand spoken language. Option B, understand written messages. Option C, hear the spoken word. Option D, speak clearly to others.
The correct answer is option A, understand spoken language. Understand spoken language.
Question 66. Red blood cells in the human body. Option A, defend the body from different types of infections. Option B, carry oxygen to areas of the body. Option C, target parasites and fungi. Option D, help blood clot after an injury.
The correct answer is option B, carry oxygen to areas of the body. Carry oxygen to areas of the body.
Question 67. Resident information that needs to be documented includes: Option A, urinary output. Option B, refusing activities. Option C, signs of depression. Option D, all of the above.
The correct answer is option D, all of the above. All of the above.
Question 68. Residents must be repositioned while in bed at least every: Option A, 1 hour. Option B, 2 hours. Option C, 3 hours. Option D, 4 hours.
The correct answer is option B, 2 hours. 2 hours.
Question 69. Residents who have had orthopedic surgery are likely to be assigned A. Option A, lengthy NPO status. Option B, weight-bearing status. Option C, speech therapist. Option D, one-on-one nursing assistant.
The correct answer is option B, weight-bearing status. Weight-bearing status.
Question 70. Residents with communication disabilities are at risk of abuse because they: Option A, don't recognize abuse when it happens. Option B, strike out at others. Option C, may be unable to report the abuse. Option D, have little control over their actions.
The correct answer is option C, may be unable to report the abuse. May be unable to report the abuse.
Question 71. Respite care can be offered in the form of: Option A, adult day care. Option B, assisted living. Option C, skilled nursing care. Option D, all of the above.
The correct answer is option D, all of the above. All of the above.
Question 72. Respite care facilities are regulated by: Option A, state governments. Option B, both the state and federal government. Option C, the federal government. Option D, the Joint Commission.
The correct answer is option A, state governments. State governments.
Question 73. Restraints used while a resident is in bed should be fastened with A. Option A, quick release knot to the side rails. Option B, quick release knot to the bed frame. Option C, safety knot to the bed frame. Option D, safety knot to the side rails.
The correct answer is option B, quick release knot to the bed frame. Quick release knot to the bed frame.
Question 74. Risk factors for acquiring MRSA include: Option A, advanced age. Option B, working in a healthcare facility. Option C, having allergies. Option D, both A and B.
The correct answer is option D, both A and B. Both A and B.
Question 75. Ruth is a resident who is incontinent and must have her incontinence garment changed every 2 hours. You have been busy this afternoon and have not been able to check and change her garment as indicated on the care plan. Ruth now has an open area on her bottom from being exposed to the urine. This is an example of: Option A, assault. Option B, negligence. Option C, abandonment. Option D, abuse.
The correct answer is option B, negligence. Negligence.
Question 76. Sarah has a skin tear on her left elbow. The wound has a small amount of drainage, and the dressing must be changed this morning. The best dressing type to use would be Option A, foam dressing. Option B, hydrogel dressing. Option C, transparent dressing. Option D, calcium alginate dressing.
The correct answer is option C, transparent dressing. Transparent dressing.
Question 77. Sharon is a resident who has an indwelling catheter in place. To decrease the risk of pulling or tugging on the catheter, you should: Option A, secure the catheter with a catheter holder attached to her thigh. Option B, hang the urinary collection bag at the foot of the bed. Option C, lay the collection bag on the bed while Sharon sleeps. Option D, change the collection bag to a leg bag while Sharon is in bed.
The correct answer is option A, secure the catheter with a catheter holder attached to her thigh. Secure the catheter with a catheter holder attached to her thigh.
Question 78. Side effects associated with cancer treatments include: Option A, fatigue. Option B, weight loss. Option C, mouth sores. Option D, all of the above.
The correct answer is option D, all of the above. All of the above.
Question 79. Side rails that are raised during an occupied bed change. Option A, are considered a positioning aid. Option B, should be lowered when you are done. Option C, should be left raised to prevent falls. Option D, both A and B.
The correct answer is option D, both A and B. Both A and B.
Question 80. Signs and symptoms of an anaphylactic reaction include: Option A, bleeding and confusion. Option B, an unsafe rise in blood pressure and pulse. Option C, shock, shortness of breath, wheezing, and facial and airway swelling. Option D, dizziness, lack of appetite, and nausea.
The correct answer is option C, shock, shortness of breath, wheezing, and facial and airway swelling. Shock, shortness of breath, wheezing, and facial and airway swelling.
Question 81. Splinting is the intervention used to decrease pain during: Option A, toileting immediately following surgery. Option B, walking the length of the hallway. Option C, coughing and deep breathing exercises. Option D, repositioning in bed.
The correct answer is option C, coughing and deep breathing exercises. Coughing and deep breathing exercises.
Question 82. Stage 1 cancer is: Option A, small or slow growing. Option B, a large tumor confined to one area. Option C, a large tumor that has spread to a different area of the body. Option D, none of the above.
The correct answer is option A, small or slow growing. Small or slow growing.
Question 83. Stage 2 and Stage 3 pressure injuries can be very: Option A, painful. Option B, blistered. Option C, swollen. Option D, hidden.
The correct answer is option A, painful. Painful.
Question 84. Stage 2 pressure injuries involve damage to: Option A, the dermis. Option B, the epidermis. Option C, the subcutaneous tissue. Option D, both A and B.
The correct answer is option D, both A and B. Both A and B.
Question 85. Standard precautions should be practiced on: Option A, only people who request it. Option B, only people who look sick. Option C, only people who have a blood-borne illness. Option D, every person you care for.
The correct answer is option D, every person you care for. Every person you care for.
Question 86. Stanley is a 70-year-old man who recently had surgery in a local hospital. His condition is stable, but he requires 24-hour nursing care. He is most likely to be: Option A, admitted to an assisted living center for rehabilitation and therapy. Option B, readmitted to the medical surgical floor of the hospital. Option C, admitted to a long-term care facility. Option D, released to his home with his spouse.
The correct answer is option C, admitted to a long-term care facility. Admitted to a long-term care facility.
Question 87. Stella is a 10-year-old girl with complete hearing loss due to an infection she had as an infant. This is an example of: Option A, an emotional deficit. Option B, an acquired communication disorder. Option C, expressive aphasia. Option D, a congenital communication disorder.
The correct answer is option B, an acquired communication disorder. An acquired communication disorder.
Question 88. Strategies to prevent falls can include: Option A, all of the above. Option B, encourage visits from family members. Option C, make sure alarms are in place. Option D, keep call light within reach.
The correct answer is option A, all of the above. All of the above.
Question 89. Syncope is the same as option A, poisoning, option B, heart attack, option C, fainting, option D, bleeding.
The correct answer is option C, fainting. Fainting.
Question 90. Tay recently had a hip replacement. His doctor told him that he cannot bend at the hip greater than 90 degrees. An adaptive tool that would help him to care for himself at home would be option A, a shoehorn, option B, elastic shoelaces, option C, a long-handled bath sponge, option D, all of the above.
The correct answer is option D, all of the above. All of the above.
Question 91. Teamwork in healthcare requires option A, equal collaboration among all team members, option B, the doctor to lead the team, option C, the nurse to lead the team, option D, constant supervision by a senior staff member.
The correct answer is option A, equal collaboration among all team members. Equal collaboration among all team members.
Question 92. The best method for ensuring proper water temperature when assisting a resident with a shower is option A, asking the resident if the water is a comfortable temperature, option B, using a bath thermometer to check the water temperature before allowing the resident into the shower, option C, allowing the water to run at least 10 minutes before the resident enters the shower, option D, testing the water with your hand.
The correct answer is option A, asking the resident if the water is a comfortable temperature. Asking the resident if the water is a comfortable temperature.
Question 93. The CDC encourages healthcare providers to make HIV testing a part of care for option A, residents in high-risk categories only, option B, residents in healthcare professions only, option C, all residents 13 to 64 years old, option D, only high-risk residents 13 to 64 years old.
The correct answer is option C, all residents 13 to 64 years old. All residents 13 to 64 years old.
Question 94. The CNA is assisting a client to shower. Which of the following should be completed prior to bringing the client into the shower? Option A, test the water temperature. Option B, apply skin lotion to the client's heels and bottoms of feet to soften calluses. Option C, have the client take off their clothes and wrap them in a blanket for the trip down the unit hallway. Option D, turn the water to the hottest setting.
The correct answer is option A, test the water temperature. Test the water temperature.
Question 95. The CNA is assisting to turn a client who has a Foley catheter. Where should the Foley catheter be anchored to prevent pulling on the catheter? Option A, bed rail, option B, upper thigh, option C, lower thigh, option D, lateral aspect of knee.
The correct answer is option B, upper thigh. Upper thigh.
Question 96. The CNA is aware of common mental health issues that are experienced by elderly adults. These may be brought on by all of the following situations except option A, the death of a spouse, option B, loss of financial independence, option C, increasing health issues, option D, faith-based group activities.
The correct answer is option D, faith-based group activities. Faith-based group activities.
Question 97. The CNA is aware that attention-seeking behaviors in the nursing home resident may include all of the following except option A, going to every social event in the nursing home, option B, refusing to visit with their family, option C, excessive use of the call light, option D, refusing to go to therapy.
The correct answer is option A, going to every social event in the nursing home. Going to every social event in the nursing home.
Question 98. The CNA is aware that the long-term care resident may resort to manipulation of the staff. The CNA recognizes manipulation as what behavior? Option A, constant complaints of pain or discomfort each time a new staff member is on their unit. Option B, lying to the other residents on their unit. Option C, refusal to take medications. Option D, sitting alone for all meals.
The correct answer is option A, constant complaints of pain or discomfort each time a new staff member is on their unit. Constant complaints of pain or discomfort each time a new staff member is on their unit.
Question 99. The CNA is caring for a client who is on precautions for MRSA. Which of the following precautions should the CNA utilize? Option A, droplet precautions. Option B, neutropenic precautions. Option C, contact precautions. Option D, respiratory precautions.
The correct answer is option C, contact precautions. Contact precautions.
Question 100. The CNA is caring for a client who is experiencing an infection with C. difference. Which of the following should be used when caring for this client? Option A, gown and gloves. Option B, gown, gloves, and N95 respirator. Option C, gown, gloves, surgical mask, and face shield. Option D, gloves and surgical mask.
The correct answer is option A, gown and gloves. Gown and gloves.
Question 101. The CNA is caring for a patient with an infection of C. diff. Which of the following would the CNA anticipate utilizing in caring for this client? Option A, surgical mask. Option B, N95 respirator. Option C, face shield. Option D, gown.
The correct answer is option D, gown. Gown.
Question 102. The CNA measures the blood pressure of a client to be 200/180. The client is not in distress. What should the CNA do next? Option A, ensure the blood pressure cuff used is the correct size and repeat the measurement. Option B, record the measurement in the record and continue with the assignment. Option C, immediately notify the nursing supervisor. Option D, measure the client's temperature and pulse to complete the vital set.
The correct answer is option A, ensure the blood pressure cuff used is the correct size and repeat the measurement. Ensure the blood pressure cuff used is the correct size and repeat the measurement.
Question 103. The main reason a nursing assistant should not wear artificial nails to work is that: Option A, residents may not like them. Option B, they hurt the resident. Option C, they may be damaged by frequent hand washing. Option D, they harbor bacteria.
The correct answer is option D, they harbor bacteria. They harbor bacteria.
Question 104. The abbreviation for the phrase "as needed" is Option A, N. Option B, PRN. Option C, PN. Option D, ASN.
The correct answer is option B, PRN. PRN.
Question 105. The areas at greatest risk of skin breakdown when a resident is in a supine position are: Option A, the coccyx, elbows, and heels. Option B, the buttocks, knees, and toes. Option C, the ear, hip, and ankles. Option D, all of the above.
The correct answer is option A, the coccyx, elbows, and heels. The coccyx, elbows, and heels.
Question 106. The best device for weighing a resident who is on strict bed rest is A. Option A, wheelchair scale. Option B, mechanical lift scale. Option C, stadiometer. Option D, bariatric lift scale.
The correct answer is option B, mechanical lift scale. Mechanical lift scale.
Question 107. The best medicinal bath for a resident with painful hemorrhoids is A. N. Option A, oatmeal bath. Option B, Epsom salt bath. Option C, bran bath. Option D, sitz bath.
The correct answer is option D, sitz bath. Sitz bath.
Question 108. The best position for a resident who needs an enema is: Option A, prone. Option B, supine. Option C, Simses. Option D, semi-Fowlers.
The correct answer is option C, Simses. Simses.
Question 109. The best way to prevent rashes in a resident who has skin folds is to: Option A, keep the area clean and dry. Option B, use rinseless products only. Option C, apply lotion to the area daily. Option D, only wash once per day.
The correct answer is option A, keep the area clean and dry. Keep the area clean and dry.
Question 110. The care plan for a client indicates they should be repositioned every 2 hours when in bed. Which of the following is the rationale for this nursing intervention? Option A, increase client comfort. Option B, provide the opportunity to check in with the client. Option C, decrease fall risk. Option D, prevent skin breakdown.
The correct answer is option D, prevent skin breakdown. Prevent skin breakdown.
Question 111. The clinic where you work discovers that one of its employees has tested positive for HIV. The clinic can legally share this information with: Option A, the employee's residents. Option B, the physicians. Option C, the employee's doctor. Option D, no one.
The correct answer is option D, no one. No one.
Question 112. The commonly used abbreviation for nothing by mouth is: Option A, NBM. Option B, NPM. Option C, NPO. Option D, OBM.
The correct answer is option C, NPO. NPO.
Question 113. The disease that is commonly referred to as the silent killer is: Option A, hypotension. Option B, myocardial infarction. Option C, cerebrovascular accident. Option D, hypertension.
The correct answer is option D, hypertension. Hypertension.
Question 114. The draw sheet should be placed on the bed. Option A, folded in half with the fold toward the foot of the bed. Option B, folded in half with the fold toward the head of the bed. Option C, unfolded with the wide hem at the head of the bed. Option D, with the absorbent white side facing up.
The correct answer is option B, folded in half with the fold toward the head of the bed. Folded in half with the fold toward the head of the bed.
Question 115. The entity responsible for regulating swing bed units is Option A, the Health and Human Services Department. Option B, the Joint Commission. Option C, state regulators. Option D, either B or C depending on the location of the units.
The correct answer is option D, either B or C depending on the location of the units. Either B or C depending on the location of the units.
Question 116. The first step in a resident's physical therapy is Option A, an evaluation by the nurse. Option B, the therapist determines the resident's goals. Option C, an evaluation by the physical therapist. Option D, the therapist designs a plan of care.
The correct answer is option C, an evaluation by the physical therapist. An evaluation by the physical therapist.
Question 117. The first step in measuring a resident's weight with a wheelchair scale is to Option A, push the wheelchair onto the scale. Option B, make sure the scale reads 0.0 pounds. Option C, remove any assistive devices from the wheelchair. Option D, press the 0 button.
The correct answer is option C, remove any assistive devices from the wheelchair. Remove any assistive devices from the wheelchair.
Question 118. The first step in refusing a delegated task is to Option A, tell your immediate supervisor that you are not able to complete the task. Option B, document the reason for your refusal. Option C, determine if you have been trained to perform the task. Option D, inform the director of nurses of your refusal.
The correct answer is option C, determine if you have been trained to perform the task. Determine if you have been trained to perform the task.
Question 119. The function of the body's T cells is to Option A, carry oxygen to the cells of the body. Option B, help blood to clot. Option C, help the body fight off infections. Option D, provide proteins needed for cell health.
The correct answer is option C, help the body fight off infections. Help the body fight off infections.
Question 120. The goal of activities therapy is to Option A, maintain a resident's hobbies and interests. Option B, keep residents busy throughout the day. Option C, maintain the resident's ability to care for herself. Option D, restore gross motor skills.
The correct answer is option A, maintain a resident's hobbies and interests. Maintain a resident's hobbies and interests.
Question 121. The goal of debridement is to Option A, remove healthy tissue. Option B, remove necrotic tissue. Option C, strengthen the tissue. Option D, decrease edema.
The correct answer is option B, remove necrotic tissue. Remove necrotic tissue.
Question 122. The goal of restraining a resident is to Option A, reduce agitation. Option B, keep them safe. Option C, keep resident from falling. Option D, stop the resident from hitting others.
The correct answer is option B, keep them safe. Keep them safe.
Question 123. The greatest risk factor for contracting the HIV infection is Option A, unprotected sex between men. Option B, drug use with contaminated needles. Option C, unprotected sex between heterosexual couples. Option D, receiving blood transfusions.
The correct answer is option A, unprotected sex between men. Unprotected sex between men.
Question 124. The inability to speak or form words is called Option A, receptive aphasia. Option B, hemiplegia. Option C, expressive aphasia. Option D, dyspnea.
The correct answer is option C, expressive aphasia. Expressive aphasia.
Question 125. The incidence of HIV infection in healthcare workers is low because Option A, HIV testing is standard for all residents. Option B, standard precautions are routinely used. Option C, facilities have post-exposure procedures. Option D, healthcare workers are routinely tested for HIV.
The correct answer is option B, standard precautions are routinely used. Standard precautions are routinely used.
Question 126. The integumentary system is made up of Option A, blood, cells, sweat, and hair. Option B, skin, hair, sweat glands, and fingernails. Option C, toenails, teeth, blood, and sugar. Option D, organs, cells, vitamins, and minerals.
The correct answer is option B, skin, hair, sweat glands, and fingernails. Skin, hair, sweat glands, and fingernails.
Question 127. The major risk factor for development of pressure injuries is Option A, immobility. Option B, poor nutrition. Option C, incontinence. Option D, advanced age.
The correct answer is option A, immobility. Immobility.
Question 128. The most common reason to collect a urine specimen is to test for option A, infection, option B, cancer, option C, diabetes, option D, kidney disease.
The correct answer is option A, infection. Infection.
Question 129. The most common type of dementia is option A, vascular, option B, Lewy body, option C, Alzheimer's, option D, Parkinson's.
The correct answer is option C, Alzheimer's. Alzheimer's.
Question 130. The normal range for an adult's heart rate is option A, 60 to 100 beats per minute, option B, 70 to 120 beats per minute, option C, 60 to 75 beats per minute, option D, 50 to 80 beats per minute.
The correct answer is option A, 60 to 100 beats per minute. 60 to 100 beats per minute.
Question 131. The number of people in the United States currently infected with HIV is option A, 60,000, option B, 100,000, option C, 500,000, option D, more than 1 million.
The correct answer is option D, more than 1 million. More than 1 million.
Question 132. The number one risk factor for developing dementia is option A, age, option B, genetics, option C, brain injury, option D, smoking.
The correct answer is option A, age. Age.
Question 133. The nurse aide is caring for a home healthcare patient when the patient's phone rings, and the patient asks the nurse to answer the phone. Which of the following is an appropriate telephone greeting? Option A, hello, Mrs. Brown's residence. Option B, hello. Option C, hello, this is Mrs. Brown's home health aide. Option D, hello, this is Sally Smith, a home health aide.
The correct answer is option C, hello, this is Mrs. Brown's home health aide. Hello, this is Mrs. Brown's home health aide.
Question 134. The nurse aide is taking routine vital signs for a 70-year-old patient. Which of the following should immediately be reported to the nurse? Option A, BP 176/100. Option B, pulse 68. Option C, respirations 14. Option D, temperature 38 degrees Celsius.
The correct answer is option A, BP 176/100. BP 176/100.
Question 135. The nurse asks you to get Emily's vital signs. You find Emily in the activity room playing bingo. You should, option A, after getting Emily's permission, take her to a private room and obtain the vital signs. Option B, get her vital signs later so you do not disturb the game. Option C, take the vital signs in the activity room while Emily continues to play. Option D, tell the nurse that you will get the vital signs after bingo is done.
The correct answer is option A, after getting Emily's permission, take her to a private room and obtain the vital signs. After getting Emily's permission, take her to a private room and obtain the vital signs.
Question 136. The nurse asks you to obtain a stool specimen from one of your residents. The stool sample may be taken from option A, a commode hat, option B, a traditional bedpan, option C, a clean and used commode, option D, all of the above.
The correct answer is option D, all of the above. All of the above.
Question 137. The nurse informs you that one of your residents has influenza. Before assisting the resident with her shower, you should put on option A, isolation gown and gloves immediately after entering the room. Option B, surgical mask before entering the room. Option C, N95 mask after entering the room. Option D, particulate respirator before entering the room.
The correct answer is option B, surgical mask before entering the room. Surgical mask before entering the room.
Question 138. The nursing assistant can clean hearing aids by using option A, a toothpick, option B, an alcohol wipe, option C, a cotton tip swab, option D, none of the above.
The correct answer is option B, an alcohol wipe. An alcohol wipe.
Question 139. The nursing assistant can help prevent skin breakdown by option A, encouraging fluid intake, option B, repositioning every 2 hours in bed, option C, offering protein-rich foods, option D, doing all of the above.
The correct answer is option D, doing all of the above. Doing all of the above.
Question 140. The nursing assistant must wash her hands rather than use hand sanitizer. Option A, after taking off gloves. Option B, before leaving the facility. Option C, after using the restroom. Option D, when caring for a resident with MRSA.
The correct answer is option C, after using the restroom. After using the restroom.
Question 141. The nursing assistant needs to release a physical restraint. Option A, every 2 hours to care for the resident's needs. Option B, every 15 minutes to check the resident's skin. Option C, when the nurse instructs her to do so. Option D, if the resident does not give consent.
The correct answer is option A, every 2 hours to care for the resident's needs. Every 2 hours to care for the resident's needs.
Question 142. The nursing assistant should check the skin beneath a prosthesis at least. Option A, once a week. Option B, twice a week. Option C, once a day. Option D, once a month.
The correct answer is option C, once a day. Once a day.
Question 143. The nursing assistant should lock the resident's wheelchair when she is. Option A, ambulating the resident down the hallway. Option B, assisting the resident with a quad cane. Option C, transferring the resident from the bed to a wheelchair. Option D, placing the resident at the dining room table.
The correct answer is option C, transferring the resident from the bed to a wheelchair. Transferring the resident from the bed to a wheelchair.
Question 144. The nursing assistant should provide oral care for a resident who is dying. Option A, each time you reposition her. Option B, 2 or 3 times a day. Option C, every 15 minutes. Option D, only when the resident requests.
The correct answer is option A, each time you reposition her. Each time you reposition her.
Question 145. The nursing assistant should trim a resident's fingernails. Option A, straight across to avoid hangnails. Option B, only on the resident's bath day. Option C, along the finger's natural curve. Option D, after applying lotion to the resident's hand.
The correct answer is option C, along the finger's natural curve. Along the finger's natural curve.
Question 146. The nutrient used for muscle and nerve function is: Option A, zinc. Option B, magnesium. Option C, iron. Option D, folic acid.
The correct answer is option B, magnesium. Magnesium.
Question 147. The patient tells you his pain is 10/10. However, the patient is smiling and talking to his visitors. You report the pain to the charge nurse because you know that. Option A, the patient may get upset if you don't. Option B, the patient has a history of a drug problem and needs pain meds. Option C, pain is whatever the patient says it is. Option D, the patient isn't in pain but he wants medication so you should get it for him.
The correct answer is option C, pain is whatever the patient says it is. Pain is whatever the patient says it is.
Question 148. The patient that is bound is at risk for which of the following? Option A, dysphagia. Option B, polydipsia. Option C, atrophy. Option D, impaction.
The correct answer is option C, atrophy. Atrophy.
Question 149. The person responsible for maintaining a resident's level of ability through range of motion exercises is the: Option A, occupational therapist. Option B, nursing assistant. Option C, licensed practical nurse. Option D, respiratory therapist.
The correct answer is option B, nursing assistant. Nursing assistant.
Question 150. The physical therapist works mostly on: Option A, swallowing difficulties. Option B, restorative efforts. Option C, fine motor skills. Option D, gross motor skills.
The correct answer is option D, gross motor skills. Gross motor skills.
Question 151. The recommended precaution used when caring for a resident with VRE is: Option A, airborne. Option B, standard. Option C, contact. Option D, droplet.
The correct answer is option C, contact. Contact.
Question 152. The specialty precaution required to care for a resident with Clostridium difficile is: Option A, droplet precautions with hand washing or hand sanitizer. Option B, airborne precautions with hand washing only. Option C, contact precautions with either hand washing or hand sanitizer. Option D, contact precautions with hand washing only.
The correct answer is option D, contact precautions with hand washing only. Contact precautions with hand washing only.
Question 153. The term battery refers to: Option A, a time when a caregiver doesn't follow her scope of practice. Option B, physically touching another person without their permission. Option C, a purposeful action meant to harm another. Option D, threatening a resident with physical harm.
The correct answer is option B, physically touching another person without their permission. physically touching another person without their permission.
Question 154. The term esteem refers to option A, a person's full potential, option B, establishing good relationships, option C, respect or admiration for self and others, option D, meeting basic human needs.
The correct answer is option C, respect or admiration for self and others. Respect or admiration for self and others.
Question 155. The term 4 times a day is commonly abbreviated as option A, QID, option B, QHS, option C, 4D, option D, QOD.
The correct answer is option A, QID. QID.
Question 156. The term proximal means option A, toward the front side of the body, option B, the side of the body, option C, away from the midline of the body, option D, the nearer of 2 points on the body.
The correct answer is option D, the nearer of 2 points on the body. The nearer of 2 points on the body.
Question 157. The treatment for tuberculosis, TB, includes option A, a long-term medication regimen, option B, eliminating triggers that cause attacks, option C, placing the resident on bed rest, option D, maintaining a low-fat diet.
The correct answer is option A, a long-term medication regimen. A long-term medication regimen.
Question 158. The type of therapy that helps a resident feel a sense of purpose and boost self-esteem by bringing back a sense of meaning is option A, reminiscence, option B, activity, option C, validation, option D, sensory stimulation.
The correct answer is option D, sensory stimulation. Sensory stimulation.
Question 159. The type of tissue only found in the integumentary system is option A, matrix, option B, smooth, option C, epithelial, option D, nervous.
The correct answer is option C, epithelial. Epithelial.
Question 160. The willful infliction of injury that results in physical harm is option A, defamation, option B, battery, option C, assault, option D, abuse.
The correct answer is option D, abuse. Abuse.
Question 161. There is a fire on your unit. What is the first thing you should do? Option A, rescue your patients. Option B, get the fire extinguisher. Option C, call for help. Option D, evacuate the unit.
The correct answer is option A, rescue your patients. Rescue your patients.
Question 162. Thinking you know a resident's food preferences is an example of being option A, subjective, option B, factual, option C, unbiased, option D, objective.
The correct answer is option A, subjective. Subjective.
Question 163. Thomas has a wrist restraint to prevent him from pulling out his 4. He complains to you that his hand is tingling. You should, option A, do range of motion exercises, option B, loosen the restraint and check him in 15 minutes, option C, massage the hand to reduce discomfort, option D, report his complaint to the nurse immediately.
The correct answer is option D, report his complaint to the nurse immediately. Report his complaint to the nurse immediately.
Question 164. To be effective, the level of alcohol in hand sanitizers must be at least option A, 60%, option B, 20%, option C, 35%, option D, 45%.
The correct answer is option A, 60%. 60%.
Question 165. To care for the resident in acute care, you must option A, have at least 120 hours of work experience, option B, have taken an acute care nursing assistant course, option C, have experience in an ambulatory surgery setting, option D, be able to identify critical situations promptly.
The correct answer is option D, be able to identify critical situations promptly. Be able to identify critical situations promptly.
Question 166. To ensure that the oxygen concentrator is working properly, the filter should be option A, replaced weekly by the oxygen supplier, option B, removed daily and washed with soap and water, option C, checked daily by the nurse and respiratory therapist, option D, rinsed with tap water and dried when it become dirty.
The correct answer is option D, rinsed with tap water and dried when it become dirty. Rinsed with tap water and dried when it become dirty.
Question 167. To prevent pressure injuries from developing while a resident is sitting in a wheelchair, you should make sure that the resident has option A, her buttocks all the way back in the chair, option B, her feet touching the floor, option C, her feet elevated on the wheelchair footrests, Option D, both A and B.
The correct answer is option D, both A and B. Both A and B.
Question 168. To relieve pressure while in the supine position, pillows should be placed under the head end. Option A, under the lower legs. Option B, between the legs. Option C, under the hips. Option D, behind the back.
The correct answer is option A, under the lower legs. Under the lower legs.
Question 169. To reposition a resident in bed, the best tool the nursing assistant can use is the Option A, draw sheet. Option B, incontinence pad. Option C, fitted sheet. Option D, mattress pad.
The correct answer is option A, draw sheet. Draw sheet.
Question 170. Two unmarried residents are cuddling in a common area. The CNA should, Option A, separate them. Option B, escort them to one of the residents' private rooms. Option C, notify their families. Option D, allow them to enjoy each other's company.
The correct answer is option D, allow them to enjoy each other's company. Allow them to enjoy each other's company.
Question 171. Upon entering a room, the CNA finds a client who is not responsive. What should the CNA do next? Option A, telephone the family contact. Option B, close the curtain around the bed to maintain privacy. Option C, call for help. Option D, page the doctor on call.
The correct answer is option C, call for help. Call for help.